Welcome back. Today is World Health Day, and the theme is Together for a Fairer, Healthier World. As countries continue to fight the pandemic, a unique opportunity emerges to build back better for a fairer, healthier world by implementing existing commitments, resolutions and agreements, while also making new and bold commitments. With more details on this, I'm now joined by World Health Organization representative to Namibia, Dr. Charles Sagoe-Moses. Thank you very, very much for joining us, sir.
Thank you very much.
Always a pleasure having you this morning in the studio.
Thank you. Mine as well.
Let's start with looking at the United Nations. The United Nations values are integrity, professionalism and respect for diversity. This is something that the World Health Organization adheres to. Could you please just elaborate a bit on this?
Thank you very much. I mean, since the organization was formed about 3 years ago, on the 7th of April, we have been adhering to these important principles of the UN.
Yes.
And we bring this into the sphere of health. And if you take the issue of professionalism, we ensure that we assemble the best experts,
Yes,
professionals in their field, in health, to be able to make available to our member states the best standards. And then we have the aspect of integrity, and we ensure that we have evidence, so that we can give advice based on available best evidence to ensure our integrity is intact. And of course, diversity, we believe that health has no boundaries or borders. Therefore, everybody is important.
Yeah.
So all classes, races, gender, and our ability to convene and mobilize all to the benefit of all. So the best to the good of all.
Yes.
And this is how, through health, we have exhibited these core values of the UN and international civil service.
Now, you've mentioned, when you spoke about diversity, you've mentioned that health should be for all,
Yes.
that there are no boundaries.
Yes.
And this comes to speaking about health inequalities.
Yes.
Now, the theme for this year's World Health Day aims to raise awareness and catalyze public advocacy to address these health inequalities, and especially looking at the COVID-19 pandemic. Could you tell us more about why it's important to distribute equal health?
Absolutely important. The COVID pandemic has brought to the fore the stark inequalities all over the world, within countries and across countries. And although the pandemic has affected everyone, all of us, those who have borne the brunt of the pandemic has been those in the informal sector, the unemployed, the marginalized, those who were already in trouble, have really been hard hit. And therefore, in responding to the pandemic, we've got to take this as an opportunity to address some of the inherent inequalities in health, in education, in the economy, all over. And these have so been magnified through this pandemic. And that is why we need to ensure that if we are looking at, let's say, vaccines, we are looking at the diagnostics, these are the testings, we are looking at the medicines for COVID, we need to ensure that we take this as an opportunity to address existing inequalities. So we do not perpetuate the inequalities that have existed. Ensuring that everyone everywhere gets protected, would have access to these essentials And that's why the GMN partners came up with the COVAX facility to ensure that global public good is made available to all. Because you are not safe, you are not secure, you are not protected unless I am.
Yes, absolutely.
We are talking about a pandemic that affects the entire world. As we speak, over 130 and counting people have been affected or infected, and we are getting into about 2 point something, getting into about 3 million deaths all over the world. So this pandemic is real, it's affecting everything, and we know here in Namibia how the economy and almost everything has been affected by the pandemic. Therefore, in responding to it, we have to address it holistically, making sure that no one is left behind.
And speaking about the pandemic, can we say then that there's an unequal distribution of vaccines worldwide?
Well, if you look at the distribution of vaccines, we have some countries that have more than twice or thrice their needs, whereas others don't have any at all. As we speak, over 400 million vaccines have been administered all over the world. Only 2% of that have been administered in Africa. Africa, the population of Africa represents about 17% of the world. So it immediately tells you what is happening. So you find that the richer countries have more and perhaps more than they need. But the important thing here is in responding to the pandemic, solidarity is absolutely important. Unless we all pull together in one direction, we would find that we are delaying the return to normalcy. We are delaying saving lives and livelihood. And unless we pull together, unless we share these global public goods, we would not get to where we want to get. Because everybody want to return to normalcy. But these are the stumbling blocks facing us at the moment. Once again, that's why we are working with governments to ensure that these things become available wherever they are, with our partners, to ensure that irrespective of where you are, you must have access to these essentials, vaccines, medicines, and diagnostics.
Yes. Now, you did mention that WHO is working with governments to help them access vaccines. In which way is WHO working with the Namibian government to ensure that we also have access to vaccines?
Okay, thank you very much. Through the COVAX facility, which Namibia is part of, we have over 190 countries that are part of this. The GMN partners are helping the government to have access to vaccines at the best price, and Namibia has already paid for the vaccines, and we are expecting that the COVAX vaccines will be in as soon as possible. We are also helping the government, or we have helped the government to develop what we call the National Vaccine Deployment Plan, which looks exhaustively at how the vaccines would be procured and administered, who should have the vaccines, and all the necessary things that must be done about it. We are also provided with experts to help government in preparing the grounds and preparing the facilities. We are into advocacy, the and communication advocacy to ensure that there's public awareness and also to increase the uptake, because basically we want to make sure that the vaccine plus all the other public health measures are in place to protect the population of Namibia.
Yes.
And I will talk a bit more about all the other, because the vaccine is one of the important arsenals or tools that we have. But there are others, and these others we have been using the public health measures. Like you and I are doing, we are wearing our mask,
Yes.
social distancing, hand washing, avoiding crowd, and allowing good ventilation. These are critical. Well, what these do are that they would prevent you from getting into contact with the vaccine. With the virus.
Yes.
And what the vaccine would do is to prime your immunity to be able to fight the vaccine. To fight the virus.
Yes, yes.
Sorry for mixing the vaccine and the virus. But the vaccine, when you have it, would help you or prime your immunity to fight the virus once it gets into you. So it's not either or, we need them all.
Yeah.
So if we get if you are vaccinated, it doesn't mean that okay, now you can go out there
and be reckless.
Yes. You're not wearing your mask. You don't obey the social distancing and all that. So it's very important that we bear this in mind. Until we get the vaccine, we must practice, and even when we do, we must continue to do that to keep safe.
Dr. Charles, let's take a look at the commemoration of the World Health Day today. Could you just explain to us a bit how it's going to be commemorated?
Yes. This year, from today till the end of the year, we are emphasizing on health inequalities and how to address health inequalities. And most of our efforts will be through the digital platform. And we would do that using various opportunities that we have. Because when we talk about health inequalities, you see it in various levels, inequalities within and across countries. You find it within rural, urban areas. You find it among the informal, formal. You find it even when it comes to specific disease conditions. And so we are addressing all these throughout the entire year. Clearly, we want to talk about 5 key actions that could be done. And to address the issue of vaccines, issue of the therapeutics and diagnostics, so far as COVID is concerned, because this is our immediate challenge. And as I mentioned, we have stacked inequalities that must be addressed, and the COVAX is one of the opportunities to do that, working with our partners.
Thank you.
Also, yes.
You can just probably have one last sentence for the sake of time, Dr. Charles.
Okay, thank you very much. I will re-echo the point I made about ensuring that we abide by the public health measures that have kept us safe till now. Hand washing, social distancing, wearing of masks, avoiding overcrowding, and also going for our vaccines, because they would help protect us. We need to protect the vulnerable. We need to protect those who are at highest risk, like health workers and frontline workers. So we encourage them to really take the vaccine and then also continue to practice these well-tested
All right.
measures that have kept us and will continue to keep us free from the virus.
Thank you very, very much for that, Dr. Charles. Thank you so much for joining us this morning. For the sake of time, unfortunately, we have to cut this interview. However, we would like to pick this up another time because I think it's a very, very important topic.
Thank you very much.
Hope you have a blessed day ahead, sir.
You too. Thank you.
Well, there you have it. That was Dr. Charles Sagoe-Moses, who's a representative to Namibia, the World Health Organization representative to Namibia, speaking about the COVID vaccine and what World Health Organization has been doing in partnership with Namibia to make sure that we have access to these vaccines. And please, as he mentioned, it's very, very important for us to adhere to the social distancing and all the COVID-19 regulations that have been put in place. And please, it's very, very important that once the vaccines are available, it's our duty as citizens to get vaccinated to protect each other.